My name is David Hanscom. I trained as an orthopedic spine surgeon. I practiced in Seattle, Washington, basically for 32 years. I just retired last December to pursue this project that I'm doing right now, presenting to the world the concepts that solve chronic pain. The medical profession, with myself included, has been trained that chronic pain is to be managed, it's not curable. The reality is the last 10 years of neuroscience research has actually revealed to us the answers to chronic pain. What I found out in my own personal practice is that we're throwing structural solutions such as spine surgery at people with a neurological problem, and it doesn't work. In fact, it causes lots of damage. It's become so rampant, I quit my practice to actually pursue this. I was in chronic pain myself for about 15 years. I did not know what to do. I didn't know where it came from. I sought medical help everywhere. But I went from being basically a fearless spine surgeon to having a panic attack in one night. And for the next 15 years, there was this endless spiral downhill with endless anxiety, panic attack. I started developing back pain, neck pain. There's over 30 potential symptoms of chronic pain. I had 17 of those at the same time. Nobody could tell me what was going on. It was unbelievable.
Okay, let's continue on to where you see the current state of chronic pain management and maybe some problems associated with that, where you see it going. Maybe you can talk more about what you've been, you wrote your book and some other stuff that you might want to.
Okay, so is this type of material you want, what I'm talking about?
Yeah.
Because I can go a lot more detail too if you want. Okay.
Yeah.
So, what happened with me is that I honestly would have no awareness of treating chronic pain. We're not trained in medical school about chronic pain, residency, fellowship, private practice, and there's simply nothing that tells us what to do. Again, chronic pain is a neurological problem. The current definition in the neuroscience world is that chronic pain is an embedded memory that becomes connected with more and more life events, and the memory can't be erased. What happened to me is that I was very aggressive, active, fearless, thought I could do anything. That's how I became a spine surgeon in the first place. And what I didn't realize back then, I was a master at suppressing anxiety. It turns out anxiety actually is the pain. And what happens when you suppress anxiety is that your body chemistry is off. It manifests itself in many physical symptoms. And out of 30 potential physical symptoms, I had 17 of these at the same time. I developed migraine headaches, I had ringing in my ears, burning in my feet, skin rashes would come and go. I developed depression, obsessive thought patterns, and the list went on and on and on. And from 1990 to around 2003, the symptoms became worse and worse and worse. And for about 7 years, it became absolutely intolerable. I wrote a book called Back in Control, A Surgeon's Roadmap Out of Chronic Pain, based on my experience. And I think the reason why the book's been so successful with so many people is that I experienced every millimeter of this myself in a really horrible way. Here I am. I went to one of the top spine fellowships in the world. I was doing major complex spine surgery, and all of a sudden I'm crippled by anxiety. And I thought anxiety was psychological. And I went through endless counseling. I talked. I went to self-help books, meditation seminars, all sorts of stuff to solve the problem. I was obviously in the prime of my career, practicing, doing great things surgically, but I was crippled by anxiety. It didn't make any sense. It turns out anxiety is not a psychological problem. It's just a symptom. When you're threatened, every living creature has a survival response. I don't know what a cat or a dog would call a sensation, since they don't have a language, they can't call it anxiety. But if you have some type of physical threat, your body goes into high alert, which includes stress chemicals, then you feel anxious. That's adrenaline, cortisol, histamines, and endorphins. What happens is that the anxiety is simply a description of the term for your level of stress chemicals. For instance, if you're laying on the beach, relaxed, you're full of oxytocin, the love drug, dopamine, reward chemicals, serotonin, antidepressant, the GABA drugs, which are actually anti-anxiety drugs, you feel great. The play chemicals, right? You feel relaxed. You never describe relaxation as a disease or a diagnosis, right? It's just a description of the state of your body's chemistry. Same thing with anxiety. It's just a survival response. You're on high alert, and it's a term that describes a chemical response that is not primarily psychological. Humans have a major problem, which I call the curse of consciousness, is that the neuroscience shows that thoughts, unpleasant thoughts, go to a similar part of the brain as a physical threat. You have the same chemical reaction. The problem is humans, we can't escape our thoughts. You can suppress them, which I was a master at doing, experience them with obsessive thought patterns and lots of ruminations, which a lot of us do, including myself. Then the problem, which is leading to the opioid epidemic, is masking. And I had a high percent of my patients were IV heroin users, drug addicts, homeless. And what drove my patients to drugs was the anxiety, the mental pain. So again, a physical threat and mental threat create the same chemical reaction in the body, except the mental threat for humans is sustained. The reason why it's so critical to understand anxiety is not primarily a psychological diagnosis is that survival response is necessary to survive. You're not going to get rid of it. It's 1,000,000 times stronger than the conscious brain. When scientists have kind of different receptors in the body, your body unconsciously is doing all sorts of things for you that you don't understand or feel, but that unconscious survival response is 1,000,000 times stronger than the conscious brain. And so just talking about the unconscious survival response is not going to solve it. In fact, it actually makes it worse. It turns out, okay, so let me just say it really clearly one more time. Anxiety is simply a measure of the level of your body's stress chemicals. High anxiety, high stress chemicals, a little bit nervous, some stress chemicals, right? If you look at it just as a measure of your stress chemicals, the way you decrease anxiety is you decrease the stress chemicals. End of story. You do that in two ways. One of them is relaxation techniques, mindfulness, relaxation, whatever, that just drops down the chemicals a bit, and it works. The other more important tool is you change the structure of your brain, called neuroplasticity. And that's where these concepts of virtual reality get me very, very excited, because in order to solve anxiety, you have to feel it. In other words, you can't solve something that you don't know. Since everybody is intent on not feeling anxious because it's a vulnerable survival feeling. By the way, if you think about this from an evolutionary standpoint, the sensation generated by your body's stress chemicals that we call anxiety is so unpleasant that it compels you to take action. You have to do something about it, right? Then when you're trapped by it, why then your body takes off like a rocket. So I was a master of suppressing anxiety. My body didn't believe me. Is that I had sustained levels of stress chemicals that translated into physical symptoms. So the bottom line is to decrease anxiety, you decrease the stress chemicals. One is directly, but the other one that's more important indirectly is you change the wiring of your nervous system. Instead of being threat, automatic survival response, you create a little bit of space, so it's threat, space, and then you substitute. If you want to fix and solve anxiety, you first of all can't do it. From a neuroplasticity standpoint, you actually reinforce it. But as you create that little bit of space and substitute, you've actually changed the structure of your brain. We do know in chronic pain, it's been documented in several studies, that your brain actually physically shrinks. When you solve chronic pain, it re-expands. We now know through neuroplasticity that your brain changes every second. And you can't control it, but you can guide it and decide where you want it to go. And that's where it's been so exciting to me to look at these possibilities with virtual reality, because again, it's just a way of reprogramming your brain. And I think the potential of actually accelerating this process is extremely promising.
Okay, can you dive into a little more of the details of maybe what you see within virtual reality in terms of how we can make both functional and the neuroplastic changes within some of these patients that we're working with?
Yeah. So let me jump a little bit into the physical symptoms that come out, then we can talk about that. Does that make sense?
Yeah.
Okay. One part I'd like to emphasize about this whole process with the inability to escape your thoughts is that, first of all, the body is just a unit. I mean, you can't fly a Boeing airplane without a computer. You can't run the human body without a nervous system. So it's just a unit response. The idea of the mind-body separation is really insane. It makes no sense at all. We respond as a unit, we feel pain as a unit, we feel pleasure as a unit. If you didn't have receptors for your nervous system to interpret, you couldn't feel pleasure, you couldn't feel pain. Remember, something is painful only because your brain says it's painful, something is pleasurable only because your brain says it's pleasurable. You have to have a nervous system to interpret your reality. End of story. So the idea of mind versus body actually makes no sense. We really just are a unit. What happens, though, is that your body has all these sensory input, your eyes, ears, mouth, whatever. Every second your brain's taking the sensory input, and if it's unpleasant, you have this sustained stress response. What happens is that the mental input you can't escape. You have a sustained stress response, which translates into physical symptoms. There's over 30 symptoms generated by sustained stress chemicals. Again, I had 17 at the same time, and things like migraine headaches, ringing in the ears. And what happens is every organ system is individually affected by this bath of stress chemicals. Each organ system responds in a different way. So for instance, the reason why you have ringing in your ears is because the nerve conduction doubles. So you're having sensations you wouldn't ordinarily feel. The reason why, for instance, skin rashes pop up is because your histamine levels have changed. There's burning sensations around the body, burning mouth, burning feet, burning fingertips, cold water down your back, because the nerves are hypersensitive. Your nervous system is sensitized because of the stress chemicals. Again, mental threats are processed the same way as a physical threat, translates into sustained body chemical changes, which creates physical symptoms. That's the key. The way I see virtual reality actually helping this whole process out is that the essence of the solution is learning to regulate your body's chemistry. And what happens, you can't do that by directly attacking the chemical response, but you can change the input. For instance, mindfulness, or what I call active meditation, is I just drop my shoulders down, listen to sounds, instead of having racing thoughts like, what do you think of me? Am I making sense? Am I talking too fast? Those are thoughts that race in my mind. What we do is just drop my shoulders down, feel, listen. What I've done is change sensory input. What I'm excited about virtual reality is a whole different dimension of changing sensory input that's very, very powerful. So if you have racing thoughts and somehow can go into a different virtual reality, again, you've changed the input, you calm things down dramatically. As you change the body's chemistry, your sense of well-being goes up dramatically. Then even more importantly is that when your body's full of stress chemicals, life isn't so great. When you're full of play chemicals, life is good. And basically your sense of well-being on this life isn't what you do or what you accomplish, it's what your body chemistry is like. Or your capacity to enjoy your life is really based on your body's chemistry. And if you're always angry and frustrated and adrenalized full of cortisol, can't enjoy your life. Not going to happen, right? But as you learn to say, okay, look, this set of thinking patterns is destructive. Don't want to do that. I want to put my brain over here. Again, it's not positive thinking, it's positive substitution. And that's why I'm quite excited about this place of virtual reality of actually redirecting the nervous system into a different spot. Again, you can't control your brain's you can't really control the survival response, but you do have a lot to say about how to direct the brain to where you want it to go.
That's great. And I hand it off to you because I have to be gone. But...
Okay. Yeah, can you bring up any common...
All right, nice meeting you. We'll stay in touch. Okay.
Any common misconceptions around chronic pain that are prevalent in the biomedical community?
Can you repeat the question? Because he was on the background.
Oh, I see. Yeah, can you tell us a little bit about the common misconceptions around chronic pain, around MRIs, operations, things like that, as it relates to chronic pain?
Right. The problem with chronic pain is that there's a research paper out of Boston that shows that less than 20% of physicians are comfortable treating chronic pain. Less than 1% actually enjoy it. The medical profession right now has simply ignored the data that the neuroscience has shown us as to the solution of chronic pain. What's happening is that I think the business of medicine is doing a lot of damage to our society right now because we're treating the story that's out there that there's always a cause for your pain. The answer, that's true, but it's not a structural cause. So we're looking for bone spurs, we're looking for ruptured tendons, whatever it is, we're always looking for a structural reason. If it hurts, there must be something broken. That could not be farther from the truth. Your brain says something is painful because, and the thing that has to do with the corporatization of medicine is that, I'll speak just for spine surgery, that's my expertise, that essentially everything we offer in spine surgery doesn't work. It's been documented to be ineffective. What we've done in chronic pain, we've put the story out there that there's always a reason for your pain. If there's something painful, there must be something broken. Well, of course, if you have an acute injury, why, that's a signal that there's something damaged that you have to protect. And of course, you protect it, the injury heals, and things move on. The problem is most things heal within about 3 to 6 weeks, but the pain can often last a lot longer. And as we mentioned before, is that a physical threat and mental threat are processed in a similar manner in the brain. We can't escape our thoughts. We have a sustained chemical response. It turns out that I think, and the neuroscience is showing this pretty clearly, that the mental pain is the driving force behind pain. In other words, if I give a patient a choice, say, look, I can get rid of your leg pain with surgery, but you have to live with the same level of anxiety that you have the rest of your life, what are you going to choose? Most people can't tolerate the anxiety. It's the mental pain is by far and away the bigger problem than the physical pain. The problem is medicine's getting focused on the physical pain, and they've developed everything has to have a cause. If less than 5 or 10% of pain has a cause, and 90% is based on your body's chemistry, neurological response to an outside threat, that's a lot of treatment being done that's completely ineffective. What needs to happen is to literally look at the neuroscience research and understand the way you solve chronic pain is you decrease the body's stress chemicals, all these physical symptoms start to disappear. So for instance, in my world, as I inadvertently discovered this whole set of processes, which this isn't. So I discovered what is, in other words, I didn't invent this stuff. I actually happened across things that actually have been proven to work. And the data shows that doctors right now are actually ignoring the data. They're actually ignoring the data that says these things work. On top of it, the treatments that are effective for calming down the nervous system don't make any money. Mindfulness, meditation, expressive writing, forgiveness, relaxation, none of these techniques actually are profitable. In my world, what's happening is that the business of medicine is prescribing techniques that are profitable. They're actually pushing physicians to do things that are profitable but not effective. But let's take spine surgery for back pain. We do know that disc degeneration is not a source of pain. Bone spurs, herniation, bulges, scoliosis, none of those have been documented to be a source of pain. In fact, they've been documented to not be a source of pain. Yet we're doing over 500,000 operations on people's back pain for degenerative disc disease. It makes no sense. There's not one research paper that definitively says spine surgery should be done for back pain. My feeling is that not only is this a surgery that's overdone, it's a surgery that should never be done. There's no data to back the idea that you should perform a fusion for back pain. None. Makes no sense. That's just one. Epidural injections for back pain. Again, not one research paper that says that it works. Well, by consistently trying to treat all pain as a structural problem, we're throwing treatments in that actually have been proven not to work. Animal studies have shown that one way to induce depression is you repeatedly dash hopes. You come to me as a patient, I promise you a treatment, I prescribe a treatment that you have some hope will work, of course, otherwise you wouldn't do it, especially spine surgery. Now your hopes are dashed. That's how you induce a depression. Very clearly, dashed hopes induce a depression, and it's severe. This is actually shown in the 1970s in primate experiments. So right now, we become very efficient at dashing people's hopes. And then again, when you're depressed and anxious, no place else to go, which I think is even worse right now in modern medicine, is that I do your surgery, your hopes have been way up. Not only did the surgery not work, you might be worse. You have a huge hope taken away. where do you go? What the surgeon does is say, well, I've done my part, have a good life. Other surgeons are not going to take on a failed back patient. Primary care doesn't like taking on other patients, surgical patients. They became very overwhelmed by the problem. There's nobody to take care of you. And so right now we're not only doing the surgeries, we're discharging people and we're not caring for them long term. The number one factor in solving chronic pain is helping people feel safe, which improves the body's chemistry, which is all around the doctor-patient relationship. That's the one treatment modality that's being taken away from us in droves. We're so wired on doing procedures and being productive, we're not talking to our patients anymore. The patient-physician relationship is the essence of the start of the process. The essence of the solution is helping the patients connect to his or her own healing capacity.
That's great. Yeah, you gave us a lot there. I think, I don't think we had to redo any of those questions, so I think we're good.
So then you and I can talk. I got to run back across the water here, but sometime I have to honestly make some really distinct decisions where I want to put the energies, how much of this project is going to absorb, and, how to deal with intellectual property issues.
This is off the books.
So I'm excited about the potential